Hello, welcome to part 40 of Clinical Physiotherapy MCQ series. Here we gon' discuss day-to-day clinical scenario with detailed explanation. Now don't waste our time, let's move to question number 196. During your examination of a patient who complains of back pain, you found pain with end range, active range of motion into hip flexion, abduction and external, lateral rotation. The structure most likely causing the patient's pain is the Option A. Hamstring muscle. Option B. Hip joint. Option C. Piriformis muscle. Option D. Sacroiliac joint. And the answer is Option D. Sacroiliac joint. Explanation to this answer is pain at end range of flexion, abduction, and external, lateral rotation. FABERE's test is diagnostic for sacroiliac joint dysfunction because it both gaps and compresses the joint. Pain at the midrange into hip flexion, abduction and external, lateral rotation suggests hip joint pathology. Now let's move to question number 197. Instruction in energy conservation and joint protection should be provided to a patient with rheumatoid arthritis, because Option A. The joints may be predisposed to damage by overuse. Option B. Fatigue often masks joint pain. Option C. Phagocytes remove more pannus in a resting joint. Option D. Activity of the antigen-antibody complex is diminished with rest. And the answer is Option A. The joints may be predisposed to damage by overuse. Explanation to this answer is rheumatoid arthritis is a chronic inflammatory disease that affects many body systems, including the joint spaces. Destruction and subluxation of joints can occur over time secondary to the inflammation that occurs in the synovium. Fatigue is a common symptom that accompanies rheumatoid arthritis. Patients must get enough rest to avoid excessive fatigue and to protect the joints from overuse damage. Therefore, education on energy conservation and joint protection is essential to minimize joint deformity. However, patients must realize that some activity is recommended to prevent contractures and to maintain strength and endurance. Fatigue and joint pain can and often do coexist in patients with rheumatoid arthritis. The pannus in the joints is actually increased with rest. Rest does not appear to change the activity of the antigen-antibody complex. Now let's move to question number 198. A 22-year-old female presents to the clinic with a chief complaint of knee pain following a twisting injury while playing soccer 5 days ago. The patient's knee is swollen significantly and is unable to jump or run. What special test would be the most appropriate to diagnose the injury? Option A. Latchman's test. Option B. Posterior drawer test. Option C. Active Latchman's test. Option D. External rotation recurvatum test. And the answer is Option A. Latchman's test. Explanation to this answer is the overwhelming majority of injuries to female soccer players is to the ACL, especially with a running, twisting injury and swelling. In addition, the Latchman's test is validated well by multiple studies. Option B. PCLs are an issue with twisting injuries, but not to the extent that ACLs are. Option C. Active Latchman's test has not had near the validation that the plain vanilla Latchman's test has. Option D. Good test, but not the most appropriate. Now let's move to question number 199. A 21-year-old female patient presents with neck pain and stiffness that has gradually worsened over the last 2 weeks. Upon examination, the patient is noted to have pain with left side bending with left rotation and reports pain on the left at the C5-6 junction. Hypomobility is also noted with right side gliding of C6. Which of the following techniques will be most appropriate to decrease pain? A. Closing technique for the mid-thoracic spine. B. Closing manipulation in extension for C5-C6. C. Gapping manipulation in flexion for C5-C6. D. Flexion, opening manipulation for mid-thoracic spine. And the answer is Option B. Closing manipulation in extension for C5-C6. Explanation to this answer is The hypomobility is noted at C6 with right side gliding and pain with left SBN rotation. Option A. The cervical spine closes with side bending and ipsilateral rotation, that is, closed with left SB and left rotation. Manipulating the thoracic spine for neck pain is a common treatment strategy. However, the specific issues noted in the question require more than just a non-specific T-spine manipulation. Option C. This would be the treatment if the pain were on the right with the left SBN rotation. Difficulty: opening the right C5-6 facet joint. Option D. Not the most appropriate manipulation, however this could be used as an adjunct to option B. Now let's move to question number 200. When examining a patient with right facial weakness, a physical therapist notes the presence of a right bell phenomenon. Which of the following additional findings is most likely to be present? Option A. Decreased taste sensation on the tongue. Option B. Abnormal tone of the right limbs. Option C. Ptosis of the right eyelid. Option D. Loss of pain and temperature sensation across the lower right jaw. And the answer is Option A. Decreased taste sensation on the tongue. Explanation to this answer is: the facial nerve, while primarily motor, does carry some sensations, particularly taste sensation from the anterior 2/3 of the tongue. Abnormal tone is associated with a supranuclear, central, lesion. Supranuclear lesions produce contralateral voluntary lower facial paralysis, so weakness would be on the other side. A bell phenomenon is not present with central lesions. Ptosis or sagging of the eyelid occurs with weakness of the levator palpebrae muscle. The levator palpebrae muscle is innervated by the oculomotor nerve. Pain and temperature sensation from the face, jaw, is carried by the trigeminal nerve. So, that's all for today. If you have any doubts, please comment below. I think you have learned something valuable today. See you on the next part, that's part 41. See you till then, bye bye.